Okay, hi, this is Alyssa Prettyman for Alyssa Yoga. This is the second in a series of 2 videos where I am responding to the question, what do you do when your back hurts or when your back goes out? Excuse me, fighting a little bit of a cold. So when my back hurts, especially if I've been driving a lot, sitting a lot, traveling, or just even under tremendous stress. I remember last holiday season, my back went out when we had like 11 people here for Christmas from the East Coast. And I feel like it was mostly just kind of the stress that I put on myself. So I do a couple key things. The first thing I'll do is I will take a big, and I'll move forward so you can see this. This is the big tune-up fitness ball. It's called the Alpha Ball. You can get it on yogatune-up.com. I like this one right in the QL. So the QL is between sort of your lowest rib and the top of your hip bone out to the side. So to find it, you basically say, okay, here's my low back, here's the middle of my low back. I'm gonna move out to the left, and I'm gonna kind of snuggle the ball into that little meaty bit of tissue between the low rib and the upper border of the hip there. So to find it, lay down, lift your hips, find the middle of your low back, and go out to the side, and then come down on it. So the ball is kind of right here, in my low back, over to the left side, so I'm not on the spinal column. And what I like about this ball is it's big. It pushes up into the body, and it sort of bypasses some of the thoracolumbar fascia and other superficial layers of tissue in this area to get at the QL, because the QL is in there. For some of us, it's pretty intense, and your main goal here is just to breathe. If it's too intense, do this same thing, but lean up against a wall, stand up against a wall, so that you can mitigate the pressure so that the whole weight of your body is not coming down. After breathing here deeply for a few breaths, I just tend to windshield wiper the knees. I'm not moving the ball from its placement. I'm just kind of rocking side to side. Rocking, I often say in my workshops, is kind of it's a calming, it's a sort of a therapeutic action that humans do when they want to calm down a little bit, I guess, for lack of a better word. Clearly my head is still a little bit fuzzy. But yeah, so rock, soothing was the word I was looking for, soothing. Rocking is very soothing for human beings. So rock side to side on the QL, let the ball snuggle in there. I've heard some people say that you can try to contract and relax into it. The QL helps you rotate and side bend, so you could slide your shoulders over to the right. You'll feel that your musculature is pushing down into the ball a little bit, and then release. Contract to the side, and release. You gotta lift the shoulders a little bit to get there. And then you're gonna take it and move to the other side. When I'm in active low back pain, I'll do that for about 2 to 3 minutes a side. 1, just breathe. So now I'm on the side that you can't see. 2, rock the knees. And maybe you do a minute for each of these. You can pause the video at any time, right? And then 3, lift your shoulders, and you can side bend if you want to contract and relax into that muscle. So that is your QL with a big ball. If you don't have a big ball, you can use 1 or 2 of the little ones, and you can put it on a block so that you get deeper pressure. So you can use those as well. But now I'm going to use a little set of Yoga Tune-Up balls. These are the Therapy Plus balls. I like them because they're a little bit bigger, and I'm like a meatier person, so I like the balls that actually move up into the tissues more. Some of the little tune-up balls, I don't feel as much, so I like to get a little bit of sensation as I roll. I'm just going to take the balls underneath my low back, lift the hips, and scroll up and down. And this one is usually a fan favorite in any class or ball rolling workshop, just to plow the balls up and down the lumbar spine. If you want to go a little bit lower, you can scrub across some of the bony landmarks around the tailbone. That can feel good. And then after a couple minutes of doing that, and if you feel anything that's like, oh, that is such a sweet spot, I just want to stay here and rock on it or stay here and breathe on it. Don't feel like you have to move forward. Respond to the information that your body's giving you. Then you can turn the balls vertically, so up and down, and sweep side to side. You will go over your spinal column. It is okay if you're using the soft, rubbery tune-up balls. You can also do this against the wall. It's not as harsh on your elbows. I know we have a lot of like achy arms, forearms, wrists, and elbows from our computer generation. So sometimes working on the wall, especially for a move like this, can just relieve the upper body from unnecessary strain. So going back and forth there feels great. So we've done the QL off to the side. We've gone up and across the lumbar spine. And the last thing that I'll do, or one of the last things that I'll do, is I'll roll out the glutes. And in my last video, I said, I'll stretch the hips when my low back is bothering me because the hips are bad neighbors. So when the hips are tight or confused, they refer pain up to the low back and down to the knees. So I find a lot of relief just rolling out the hips. You can take your 2 tune-up balls, lift your hips, plug a ball underneath each cheek. And essentially, to help you find the place, you find the top of your butt crack, you go a little out to the right and a little out to the left. I always say, I know it sounds lewd, but like now you know exactly where I'm talking about. A couple things you can do here is contract and relax. You'll notice that my hips lift slightly when I contract because I'm squeezing my gluteal muscles. And then relax like I'm going to absorb the balls with my body. Hold the contraction. Slowly relax. Make sure that you're breathing so that you're not fighting with your own nervous system when you do this deep tissue work. And then after about 2 minutes of that, I'll plant one foot on the ground. So I'm going to plant my right foot on the ground, remove the right ball. Now the right foot helps me drive as I drag this ball back and forth underneath the left cheek. So I'm just going from the midline out to the edge. I might even feel the edge of my femur bone, the greater trochanter out there, as I scroll the ball back and forth on the top of the butt cheek. If I stay up higher on the cheek, I can impact the piriformis, which can be another culprit in low back pain. So side to side there. If you want to explore other regions of the hip, you can go lower. You find your sits bones down there, the ischial tuberosity. You can kind of gyrate around those a little bit. You can press off into, there's like a gully around the top of your femur bone there, between the tissue and the edge of the bone. And I just kind of like to press in there and see if I can just create a little bit more spaciousness around this area of the hip joint. So side to side, move in and around that femur area. If you want to go lower on the cheek, you can. And then switch sides. Put the ball back under the right cheek, let the right knee drop out, my left foot comes on the floor, and I'm going side to side. I might go lower on the cheek, draw little circles on the cheek, or again, it's almost like a little crescent moon arc around the area of the hip where the where the glutes meet the top of the femur there. And just kind of pressing around out there, seeing how that feels. So those are the main things that I do on the back. The other thing that you can do if you want to start to release another culprit for low back pain is get at the psoas and hip flexors. I love the Coregeous ball. I've seen people use Pilates balls or even the cheap balls that you can get at Walmart in like the ball cage that kids always ask you for. You can also roll up a towel or a blanket and just make a slightly firm surface to put against your belly. But I'm going to start in the space kind of right around the navel, maybe just a little bit south of the navel, and see if I can relax here a little bit. It's pretty intense, and if you just ate, this is not going to feel fantastic, so wait until maybe you haven't had too much to eat. But you can, again, contract You'll see I lift as I squeeze the belly muscles and relax. Try to absorb it with the body. Inhale, contract, exhale, relax. One more. Now, if you're just getting used to it, see if you can do that 5 more times. What I'm going to do here is just like I did with some of the other rolling techniques. I'm going to rock a little bit side to side and snuggle the ball into the tissues. And then I'm going to move, when I feel ready, I'm going to move out to the right. So I'm right kind of over the ASI, the front of the hip bone, on the sideline of my body. I'm going to lean to the right and I'm going to drag the ball into the middle. I'm going to lean out to the left side and then I'm going to drag the ball into the middle. And then I'm going to do this and maybe move a little bit lower on the body. So I'm kind of right on that space between those 2 bony protrusions on the front of your hips. And I'm just going side to side. And I'm just trying to move at some of the muscles on the front line of the body, that muscles and organs on the front line of the body. It's hard to talk and breathe and do this at the same time. That help flex the hips. So psoas is really deep in there, but you're rubbing out a lot of this stuff on top of it, and you might find a little bit of relief if you can release the front line a little bit. Because the reality is we spend so much of our life like this, really short on the front line with our hips in flexion, right? With our hips flexed forward. So this part of us gets really tight and it can pull our spine down into this position because it's just so used to being in this shape. So if we can create a little bit of spaciousness and freedom here, sometimes you can find relief there too. But those are the things that I will do when my low back hurts, and I usually find a decent amount of relief there. I will say that I also use anti-inflammatory when I'm in super active pain, so I'll use Advil. I'll use ice and heat in about 20-minute increments, and I will rotate that. And I also hang upside down. I have an inversion table. I have an aerial yoga swing. You can get them for under $100 online and put them in a doorway. And I find hanging in inversions to be almost instantaneous and measurable in the amount of pain relief that I find with that inverted traction in the spine. So if you are interested in that, you can email me or go see an aerial yoga teacher and ask for a private session and just tell them that you have low back pain and want to learn how to hang upside down safely or invest in an inversion table. These days, those tools are pretty cheap. They're under $100, and I think it's worth it if it helps alleviate your pain. So if you have questions, let me know. That is the quick and dirty low back rolling sequence. If you pair it with the yoga sequence, try inversion and some of the other ice, heat, anti-inflammatory stuff, hopefully you'll be up and running and feeling great in no time. See ya.